So our next speaker is our very own Kyle Brew from OneUp Health, and Kyle's the head of product for health plans. Kyle is basically going to present on clarifying aspects of CMS mandates related to authentication, consent, and app vetting, and especially how OAuth2 and OpenID Connect will support the third-party apps. Welcome, Kyle.
Oh, thanks, Christina. And thanks, Amal. Good to see you again. All right, yeah, so as Christina mentioned, I'm going to spend the next 30 minutes going over kind of how we've approached our OAuth2 server for the CMS Patient Access Mandate, but further beyond that, also touch on some of those other aspects around member consent and authentication and authorization. So let me dive right in. So I think this might have been shared earlier, and I won't spend too long here. I think the thing I really want to mention is we at OneUp Health really started as a company connecting to clinical endpoints where the EHRs were mandated by meaningful use to expose FHIR APIs to third-party apps. So essentially the direct analog or analogy to the CMS mandate, however, on the provider side with clinical data. So if you were seen at a Epic or Cerner or ECW provider, you had the right to share that data with a third-party app similar to health plans. And so we've connected to over 10,000 of those endpoints at this point across the US, spanning the likes of Mayo, Kaiser, down to independent physicians on ECW. So seeing a lot of those endpoints and how things worked on the clinical side, and that kind of positioned us to kind of be ready to kind of re-leverage the same platform for the CMS mandate that I'll share some information about. And so as we think about the rule, hopefully at this point, 4 o'clock, 4 hours in, you've gotten this far, but if you're just joining, great. I'm definitely focused on the patient access API here, but similar concepts about patients giving consent and authenticating will also apply to payer exchange. Really does not apply to provider directory, given that must be a public open API endpoint, meaning no OAuth, no tokens, just a open API that gives provider directory. So won't spend any time there, but we'll focus the time here on the patient's ability to be able to share claims, encounter, and the subset of clinical data maintained, as Denise nicely defined for us earlier, the data they maintain within their systems that they can share with third-party apps. So when we think about this, this is how we kind of view how we break down the various aspects of the rule and what you need to be compliant for next July. So won't be focusing on data transformation, definitely a big challenge, and all the hard work Amal has done in terms of the Karen BB IG and others working with Amal, Pat Taylor and Josh Lamb and many others who have worked very hard on just defining what the data format needs to be. And then there's obviously ongoing efforts of how do we take that IG and actually implement it and make it real and get it into a FHIR server. So kind of those outside the scope of right now, but obviously important topics and definitely long poles in the tent in terms of implementation. I'm going to center around kind of third-party access management, the idea of kind of the OAuth and OpenID processes, apps, and then specifically members being able to come in, prove their identity, and then share that data with the third-party app downstream. And that's what I'll focus on right now. All right. So when we think about this patient access API, as I mentioned, and has been mentioned many times today, by next July, health plans are going to be required that they have FHIR R4 APIs so that patients can access and share all of their claims, encounter, and the subset of clinical data. So whether the health plan might maintain lab data from a Quest or a LabCorp, they might maintain immunization data, maybe allergies from, or maybe other clinical data in a care management system like a Z Omega or whatever the kind of internal care management systems are they maintain. So that data that the health plan has today is going to need to be exposed via FHIR APIs. So FHIR being both what the data is stored as its format, as well as the transport mechanism. So it's a FHIR API to say, give me EOBs for this patient, explanations of benefit, give me the various patient demographic information, all those various resources that are required by the rule. And so what's kind of gating all of this, and as Denise put and others, at the center of all this is the patient. So member, patient, whatever your lingo is, but it's ultimately the patient's decision to want to share his or her data with an app that they choose. So they're going to go through the work of finding an app on their smartphone or mobile device, or on maybe their laptop. They're going to go through the work of finding an app that they trust and they want to use. They're going to worry about logging into that, apps like Be Well earlier, others that Ryan mentioned. And once they do that, they're going to need the ability to be able to say, I want to connect to my health plan data that's sitting at my health plan today. It's my data, and I'd like to share it with this app. And then as they do that, I'll go through kind of the specific steps of kind of OAuth and how those handshakes work. But at the end of the day, the app would get a token and be able to actually use that kind of token or a key to unlock the APIs that to call for the data that it wants for that specific patient. So it could be a kind of member 360 view like Be Well. It could be some kind of disease or condition specific app for, say, maybe if you have diabetes or Crohn's or another chronic condition. There may be an app that you use to kind of manage your symptoms, manage your condition, or it could be some kind of future kind of gamification, whether there's kind of more and more incentives to kind of track and manage your health, all the various ways you do that. And maybe one of the kind of ways you can kind of incentivize people is saying, connect me to your claims data for XYZ purpose. So all of that being said, this is the high level. This is really where I'm focused today, is this patient access API. And this definitely is the majority of the work that's going to need to be done before next July. So when we think about authentication, so there's kind of authentication, and really there's kind of member identity verification, which go hand in hand. And so when we think about this is me or whoever the patient is proving that they are who they say they are, and that it's them who's trying to authorize and consent that the data be shared. So there's a number of ways this can be done. This could be via their existing member portal. So if health plans today, like many do, have a member portal, regardless of whatever technology it is, like I have one with United Health Group, whatever health plan you have today, you have a way of logging in, viewing your claims, other features and functionality that the health plan has, that when I log in, it knows that that I'm proving that I'm me via my credentials. So that being one way where we could use those same existing credentials and could connect back into that kind of system where we're either using SAML, maybe it's could be OpenID Connect or OAuth directly, but some way that we are actually using the existing member portal process today that already exists, and that being the way the member proves they are who they say they are. There's other ways of doing this, whether kind of more multi-factor, email or SMS text-based. There's even zero knowledge ways of doing this. So for instance, if you know like ID.me, Experian, TransUnion, they do offer ways where if I needed to, I could actually go in and answer a series of questions based on the data Experian has about me, for instance, to prove I am who I say I am. So whether it's about car loans, other previous student loans, something about addresses, they call those invasive non-wallet questions. So a series of those questions could be another way where I'm proving that I am who I say I am, but that's another way. Or I could be emailed a code and prove that by using an email that is my email, I could prove it that way, which a number of other apps I'm sure you all use that, and other kind of two-factor auth or multi-factor auth, which it's not required for CMS, but definitely is something that most are looking to get towards for privacy and security concerns. So these being some ways, I think the most common way would be number one, where health plans have already put in the effort and the work to stand up this member portal, have a way to log in. And there's also so much additional complexity around if I'm logging in and I have a child, or let's say I care for a parent or another adult dependent, I need a way that when I log in, I'm saying, am I doing this for me? Am I doing this for my child? Am I doing this for my parent at home? There's a number of kind of scenarios that get very complex very quickly, as I'm sure you all know, that need to be addressed. And so a lot of that logic is already built into these portals. So you'd want to use the same business rules and logic and try to, rather than recreating the wheel there. So I'll get more into proxy or delegate access in a minute. So in terms of kind of how this OAuth flow works, kind of the handshake, and this is what CMS is specifying is the standard for doing this is OAuth2, OpenID Connect, Smart App Launch. So when we think about on the left here, this would be any third-party app that I've kind of already mentioned plenty of examples of out there. So let's just say it's a health history app that kind of consolidates all my data, gives me a view of kind of 360 around what my data is. And as I kind of mentioned, if I came in, I download it to, let's say I have an iPhone, I download it, create an account, sign up, all those things. I'm in the app, it knows it's me. And now I say, you know what, I want to connect my health plan data. So at that point, I would search for my health plan. Let's say it is United. I would search for United. I would be directed to a way to prove that I'm who I say I am. So on the right here, this is kind of our way of doing things, but there's obviously other ways of doing it as well. But this being one example where when I click that, I'm actually leaving the app briefly. I'm going to this separate app where I am actually I'm verifying my identity, and then I'm actually authorizing that, you know what, I trust this health history app. I've already downloaded it. I clearly understand this is pretty abbreviated for just simplicity purposes on the slide, but this would clearly explain that I'm sharing XYZ data. I'm sharing my claims, my encounters, my clinical data, what those clinical data is, so that I clearly I understand that I'm sharing this data. And then further, I would want my health plan to help me know that they have attested or had this app attest that, let's say it met the care and code of conduct, or let's say it verified that it doesn't just sell my data, or other kind of standard privacy and kind of terms of service policies that you'd expect of an app using health data. So I would want all that information kind of there at my fingertips when I'm making this decision. But as I make this decision, again, this is kind of one way where, let's say I am using my credentials. So it would direct me to use my kind of United credentials for my portal I typically use to kind of say that I'm me and I'd like to share this data back. And so behind this, it would actually connect via SAML or other ways to actually pass the credentials, give them back. There'd be kind of flows for what if I forgot my username or forgot my password, or let's say I tried logging in 10 times, I might be locked out because that's how the business rules are set up. So all those things would be in play so that you can't just have a bad actor just kind of brute forcing their way in. But anyway, let's say I do it the first try, it's right. As I authorize, as we continue this flow, sorry, 2 slides. As I continue this flow, this app on the left would then receive a code via the OAuth process, and they would exchange that auth code and the OpenID token information with the Fire server. So in this case, showing our platform, but this could be any of the health plans Fire servers in the middle here. And using kind of that code, they'd get that OpenID token and access token. And that access token would have an expiration, and it would also be specific to that member who is logging in. So it'd be that access token would be a key to only unlock that one member's data who signed in and verified, or it could be a child on their behalf. And it could have further scopes associated. So not required for CMS, but can be supported is the idea of kind of scopes where my token could be scoped to only have access to medications, let's say. So in that case, let's say it's a medication management app where it wants to know, based on my claims, here are all the meds I'm taking. Then that app might only need medications. It doesn't care in claims. It might not care about allergies or other things. And so it would have a token that only was good for the data elements it was requesting. And kind of that all being said, so this specific token would then be used to say, give me the Fire data you have for this member. And then from there, it's on this app on the left side here to use that data and however it's going to use it. And so from there, I'm kind of back in the app. I'm back on my iPhone, I'm back multitasking, I leave the app, come back. It has my data. It can visualize it. It can notify me about changes, all of those things. And so kind of built into this process also is the idea of you'll have that access token, and our kind of standard is 2 hours expires. But in addition, you'll also have a refresh token. And so per OAuth, you also get a refresh token, and that typically has a longer expiration date. And so CMS is recommending, not requiring, but recommending that that be a 3-month kind of expiration. So the app would be able to, for the next 3 months, be able to go ahead and continue to refresh the data in the background without me in the loop. So I've consented to this. I've shared my data. I knew what I was doing. That CMS is kind of the intent of this. And once I do that, this app could continue to refresh the data. But after 3 months, while the data would still be in the app could keep that data for as long as it wants. Once after that point, if they want, the data could become stale. So that data could start to be incorrect or outdated. And so the app may have various ways of, after 3 months, triggering me via notification, or the next time I open the app saying, you know what, this data could be stale. Would you like to reauthorize? And so in that case, I would need to go back through the same flow. I would again need to prove I'm me, tell my health plan, yep, I want to share this again. And that just kind of protects me from just kind of leaving my data a door open for the rest of time. And so that's kind of how this standard kind of flow works between just a third-party app on the left and a kind of the member consenting on the right. So when we think about, as I mentioned, we have quite a bit of experience doing this on the clinical side. And I think between that and Blue Button, those are kind of the leading examples that health plans have about how does this work today and how they think about this. And so in terms of providers, how they do it. So this is a real kind of epic example with their kind of their sandbox, where if I go to a provider on Epic and I use my chart, which is their patient portal, I could use consent to sharing my data that's within Epic with a third-party app. And so this is kind of how they explain it to me. So I'm sharing my health data. I'm sharing this specific types of data, allergies, labs, procedures, et cetera. The app will have access to this information until such and such a date and time. So it's very clear kind of what am I allowing, what access to what, for how long, and to some extent why. So, and here we even see an example. The app has not informed us how they plan to use your data. We recommend that you deny access to your account. So this is a very real example of, I still could approve this. It's my decision, but Epic wants me to know that they're not sure this is a trustworthy actor. And so similar kind of logic applies, where you want your members to make informed decisions, and it's still their decision. You can't stop them. I think the analogy I've heard is if someone wants to go and print their PHI health data, stand on a corner of a street and hand them out to people walking down the street, it's their data, it's their decision. Obviously, they're not going to do that, but it is their data. And so this is obviously kind of guarding against that and giving you kind of tools to let your members know. But this is a real example where me as a patient who uses Epic, after I give my chart credentials, I would say, I've read all the statements, allow or deny access to this app. And then further, as I kind of alluded a few minutes ago, I think one of the really big challenges here is proxies and delegates. And I think it's often a little bit underestimated in terms of how much work there really is here, because there's so much state law complexity, and there's so much just general complexity of many-to-many relationships. And whether it's kind of the simple example with parent or child, there also are a number of examples in terms of specific ages. So in some states, if you're between the age of 13 and 18 and you're a child, then your reproductive birth control can't be shared with your parent. So there's all this existing logic that exists today for health plans where they're already complying with not sharing HIV status, substance use, all those various sensitive data elements that shouldn't be shared today. The same logic applies, but there's still complexity here that how do I know that when I'm logging in and sharing my data, I'm going to share the data for me or my child? And so this is kind of how providers did it, where it shows the various profiles Jason or Jessica Argonaut in this sandbox, but am I sharing this for Jason or Jessica? And this is a simple example, but this same kind of types of features are definitely going to be required for health plans as they think about the various relationships between adult dependents, legal representatives, caregivers, all of those kind of standard relationships where you may be acting on behalf of someone else. And so all that's important. And I think when we think about it with OneUp Health, we're capturing, this detail is getting captured in a FHIR consent resource. And this is not required by CMS, just kind of our approach to this and others as well. And so when I make this decision to authorize, we capture a FHIR consent resource that bundles in, here is the time the consent was given. It was me on behalf of someone else, or it was me on behalf of myself. Maybe it was for these specific scopes. It expires on XYZ date, and it's for this app. So all of that metadata about what am I consenting to, how long, those are all kind of key. So that's kind of all kind of baked into this. And so I know we're running a little out of time, so I'll try to leave some time for questions, but we're definitely seeing that data sharing via patients is happening already. And this move by CMS is only going to accelerate it. So whether it's life insurance, whether it's online second opinion, whether it's just other apps like BeWell, data sharing via patients is definitely growing and is continuing to grow. And I think this kind of a middle example definitely had a great deal of traction because of COVID, where no one wanted to go see a doctor in person. Both sides didn't want to. And so Mass Mutual was using kind of the patient as a way to say, electronically send me your data, consent to it, send it to me, and I won't require you to go get a physical. So just one simple example. Number more here about registration and the gap. I'll go over, let me just see. Yeah. So last slide, and then leave some time for questions. In terms of kind of third-party apps, just want to briefly mention, so how did they get to this point where they're on my phone, I'm using them, connecting to my health plan data? They would have to register. So as they register, they understand here are the endpoints. And further, as a health plan, you can say, I want you to attest to these privacy considerations. How do they handle a breach? Do they allow their members, the users, to be forgotten? Do they delete the data when they delete their account? As well as security. So are they SOC 2? Are they high trust? What encryption do they use? All of those details can be captured. And as Denise said very clearly, there is no concept of vetting that's allowed. It's really that you can ask for this information as they register, and the app can either ignore it, not send you anything, or say, no, I do none of this. And in both cases, it's on you, the health plan, to let your member know very clearly that before they get to the point of finally clicking, yes, share my data, that this app is going to sell your data. This app is never going to delete your data. All the things that it didn't attest to, you want to flag that to your member. So I'll stop there. And I guess, I don't know, Christina or others, if there's any questions, I'm happy to share.
One question from the audience, they're asking, what information can health plans provide to members when they are providing consent and authorization to third-party apps?
Yeah, definitely. So I think I gave that kind of example from the provider standpoint, but I think this, this is a starting point, but there's a lot more you could share. So you definitely can share, you can do a link to the app's privacy policy, terms of service. You could have kind of a summary of this is what the app is doing with your data. You could have kind of simple, however you want, icons saying, are they going to use your data for other purposes? Like, are you going to start getting ads for a specific condition because they sold your data to Google or whoever? Are you going to kind of all those kind of things I just mentioned from a privacy and security? You'd want to let your member know here before they click allow access, all that detail. And then further, you just want kind of the member to have kind of ability to ask questions. So maybe a link to FAQs, or maybe there's a way to get on the phone with someone. If this is Medicare members or others who, I mean, this could be a very novel concept, and some of this is not easy lingo. And especially when you're thinking about FHIR resources, it's not as approachable as other things. So you want to have some way of like support, some way of kind of just information, and kind of doing that in kind of plain language, icon, whatever it is, 508 compliance, all of those things would kind of be on this screen.
Awesome, that's helpful. Another question someone had was, what does the CMS rule say about scopes of access for third-party app tokens?
Yeah, so Denise covered this a little early, or covered this briefly earlier, but let me kind of jump in. This is a little bit dense, but this is kind of how we've captured what CMS is saying about scopes. And so really, as Denise mentioned, the intent of the rule is all or nothing. So they are expecting that if a member goes through all the effort to download an app, make an account, sign up, get to the point of finding their health plan, verifying their identity, if they've gotten through those 4 hoops, they're kind of like opting into sharing all my health plan data. So my data is at my health plan. I want to share all of it. What I'm not saying is that that means sharing HIV status or substance use. There are certain laws, there are certain local, federal, other laws that will supersede all of this. But in general, for the types of data that the rule applies, it's an all or nothing. So that's kind of, if you want to be compliant with the rule, that's it. What CMS isn't doing, however, they're not going to say you, the health plan, can't do more. They're not going to stop you from doing more work. But their kind of expectation is all or nothing. If you want to go ahead and offer the ability that, like my example, an app that only wants medications, only requests that scope, you, the health plan, can support that. However, at the end of the day, it's the patient's choice. And if the patient really does come in and say, I want to share all of my data, you can't stop that. So you can't get in the way of that. That's not the spirit of the rule. So we kind of think about this in terms of scoping at resource level. We also kind of filter out sensitive data, like I've mentioned. So there's a number of like technical ways to do it, but from a CMS standpoint, they're really going for this all or nothing.
And then one more question we had from the audience is, what are some items health plans can look for during third-party app registrations?
Yeah, so let me see. I think I have, yeah, okay. So these are some samples, not exhaustive, but, and there's even some that have come up today that I find kind of interesting as well. But these are some examples of questions and attestations you can ask, whether it's kind of specific certifications, how they handle certain situations, regular security testing. Is the data going to stay in the US? Is it going somewhere else? And then earlier, there was also some mentions about, does this app, is this app going to be accessing location, your location data? Is it going to be one of those apps draining your battery in the background all day that just knows where you are at all times? And you want to kind of flag that, especially for less tech savvy users who might not know to think about that, that you want to ask those apps up front. Are you sharing this data with others? Are you tracking location? Do you have microphone access? All those things that you have to opt into on an iPhone, I'm sure similarly on other phones. But those are some things, as well as kind of these being privacy and security specific things that when as you're letting an app register to actually get on your API, these are some of the things you can look for. And regardless of their answer, you may still have to, they can still register the app, but then on that screen, that last question, members would definitely want to be informed that this app has XYZ permissions globally. It does encrypt your data. It deletes your data when you're done. All of those things are something I would want to know before I trusted an app.
And then a last question. So if anyone's interested to learn a little bit more about OneUp Health and OAuth, who would they reach out to?
Yeah, so you can go through VHC today. My email is just Kyle at OneUp. Sorry, there it is. Kyle at OneUp, Ricky, Christina, but yeah, any of us, we're happy to take the answer. There's also a number on our slides on the very first page. There's some links here. This is the CMS rule more broadly. This is specifically OAuth and how we support it. So pretty easy to find on our website. Once you get to the CMS rules section, there's an OAuth subfolder or subpage. But if you're having any other questions, definitely reach out to Kyle at oneup.health or go through our contact page on our website, and we can definitely let you know more and share more there.